more than 230 doctor posts are currently advertised in public media outlets, and 375 more are expected to be advertised in the next 6 months. That's at least according to Health Minister Dr. Joe Phaahla, who gave an update on the employment status of doctors. The briefing follows concerns raised by health unions over the excessive number of unemployed doctors in the country. Let's understand the situation a bit better. Bring in the General Secretary of the South African Medical Association Trade Union, that's Dr. Cedric Sihlangu, who joins us now via our video link. And Doc, it's lovely to have you on the program. Thanks very much indeed for making time. I've got in front of me here the Minister's briefing from yesterday, or at least his remarks. And part of what he's putting this down to, this issue around there being doctors essentially sitting at home, is that there was a 7.5 salary adjustment agreement at the Public Service Bargaining Council, which presumably is making it difficult for the public sector to continue hiring more doctors. In layman's terms, the minister's saying salaries for doctors are making it hard for them to get jobs. Is that a fair diagnosis?
Completely missed the point. And good morning, Ayanda, and also to your viewers. Look, the minister's media statement was really empty. In fact, the minister comes to the nation to tell us of a known problem, that there are a lot of unemployed doctors. What the minister then fails to do is to acknowledge that we've got a collapsed healthcare system, particularly the public healthcare system. Now, we just find it very bizarre that the minister conveniently wants to, bring this as a result of a 7.5 salary increment that happened this year. If you remember, we were in the same position last year. We even marched to the offices of the minister in Pretoria, raising sharply the same issue where the cohort of 2023 had about 1,000 unemployed doctors, and we had to deliver a memorandum to the minister, but even the year preceding that one. So this has been a systematic collapse of government. But it's strange because you've got the Budget Council, you've got the National Health Council, and you also have the extended cabinet with the Coordination Council. So all these issues are well known to government. And when we talk about government, we're not speaking about the Department of Health in isolation. We're talking about government as a whole. So surely a responsive and responsible government ought to be able to diagnose the problem, put systems in place to avert this. But that hasn't been done.
What is incredibly concerning, of course, is that this is so counterintuitive. Like, we have a situation where we do know that doctors who are in those posts are incredibly overworked, many of them feeling like they're reaching the end of their own tether, while the colleagues who could have the capacity to assist them are sitting at home. If you were in a situation where you could take charge of the solution, what would that look like? I mean, I'm not asking this superficially, if you know what I mean, but there are clear structural issues that are preventing these much-needed doctors from working in these hospitals. And I get the sense that those of us in the outside don't really have an appreciation of just how deeply entrenched these problems are.
Look, we first have to start from probably a constitutional basis, understanding that healthcare is a basic human right. I mean, if you can really grasp that concept, you'll realize that it is an absolute priority. And from there, I've indicated the various instruments of government in terms of the Budget Council and all these relevant entities that must consider the fiscus and decide how to prioritize. But what we say is that we have seen government being able to bail out SAA, being able to bail out airports companies, South Africa, you name them, ESCOM, right? So this requires political will. But you see where the problem is. And if it were for us, we'll just scrape this PAMED that the parliamentarians and the executive enjoys, because they've got these sophisticated medical schemes which when they go to the private hospitals, they get treated like royalty. And because of that, they preside over the public healthcare system, but they do not subscribe to it. And what that does is it removes any exigency, any agency to resolve the problem. So they can dispense with the situation as it is, because when a minister's child needs healthcare attention, they go to a pediatrician. This is a specialist for babies. But when the average layperson needs health care, they can't even find a generalist, a GP. Now, it tells you that the people who are in charge of the system, because they don't subscribe into it, they therefore have got no motivation to really act with speed in resolving the problems. Now, we need to start and scrape these things and say, if you're a parliamentarian, if you're a president, if you're a minister, you're not going to be utilizing these private hospitals. You must use the same hospitals that you are actually presiding over.
The Minister, of course, took time to address the organization that you're part of, the South African Medical Association Trade Union. According to him, you submitted around 825 names of doctors who are essentially sitting at home as of January last year. The Minister then saying that they did their own checks and found that out of these 825 doctors, 694 had completed their community service. But do you have answers around when these doctors would be able to get into post? Because these are obviously people who've gone through the training, who've done the 9 yards, and quite frankly are ready to assist.
Look, and we did a full-on survey around about towards the end of December. We had to collect data so that we can be proactive in ensuring that we engage with the provincial departments, we engage with the national department to say, look, we anticipate that when these doctors' contracts come to an end on the 31st of December, they will be unemployed. They are all willing to go and serve the communities and to go to the public facilities, to go to the rural areas and so forth. We said, we are presenting to you these numbers. These numbers are coming directly from those who are seeking employment. Lo and behold, when January hit, all those doctors were unemployed, over 800 of them. And that was based on the numbers we collected in December. I tell you now, those numbers have gone up from 800 to over 1,000. Because as the days progressed, more and more doctors came forward and said, well, I thought I had a job, but I'm not able to work. So can I please be included in the list? So that number has actually increased. But till now, all the minister does is he comes on the national platform and says, look, we will be advertising posts in the next couple of months, 6 months or so. But imagine 6 months of not having a doctor in a facility that is fully equipped, waiting for the skills so that you can give out healthcare services. Now, that for us is unacceptable. It's an untenable situation, and it requires, as I've indicated, the agency to deal with this problem. But again, you'll have lethargy because the people that have to solve it are okay.
The concern here, of course, Dr. Sihlangu, is that this may very well lead to a brain drain in the country. You know, the best among the best will not agree to sit at home given what they've invested in their own careers. And let's face it, there are alternatives elsewhere. And what's tragic about that is that it leaves South Africans who need the service in the lurch.
You see, Ayanda, you've hit it right on the nail because, you see, when a government wants to improve health outcomes, one of the key issues is to deal with the health workforce, to improve it. And a strategic decision was taken in terms of various documents, the National Development Plan and many other instruments, that we needed to increase the number of health workers, including doctors in the country, so that we can better the health outcomes. Now, the government took that decision. Now, it was so myopic that despite saying you're going to ramp up the training of doctors from just under 1,000 to over 2,000, you don't see the plan through to say after the training, what do you do with them? You've got to place them because the purpose of the training is so that they can qualify and come back and serve the nation. What we've done now, we've trained doctors both in South Africa and abroad, in Cuba and you name it. Now when they are ready to serve, we say, well, the market is free. You can go to the international market, go to Cuba, to Canada, Australia, and anywhere else. We don't have space for you, and yet we trained you to come home and serve our people. It's very strange. It actually is very baffling because we would have expected that having had trained these doctors, it's now time for them to come and serve. I'll give you a quick example with the police officers. We trained over 20,000 just last year alone because we realized that crime is a big issue in this country. When the policemen were done, and men and women were done training, we put them in the various police stations. We didn't say to them they must go to private security companies and find employment. Imagine if we did that, it would really be ludicrous.
Sure. Really concerning the situation here, and again, feels very counterintuitive for us watching from the outside. Dr. Sihlangu, thanks for giving us your side of the story. I appreciate your speaking to us on the AM Report. Dr. Cedric Sihlangu is the General Secretary of the South African Medical Association Trade Union.